Did you know that nearly 70% of older adults suffer from high blood pressure, but many don't even know it? If you're over 60, you're more likely to have high blood pressure than anyone else. So, what's the ideal blood pressure for older adults, and why should you care? As we age, managing our blood pressure becomes more important than ever. High blood pressure, also known as hypertension, is one of the most common health conditions in older adults and can lead to serious problems like heart disease, stroke, and kidney failure. In today's video, we're diving into what blood pressure range you should be aiming for and how it can affect your health as you get older. By the end of this video, you'll understand what blood pressure numbers to watch out for and why it's essential to keep them under control. Stick around, because skipping any point could mean missing out on vital information that could change your health for the better. What is the ideal blood pressure for older adults? For older adults, maintaining an ideal blood pressure is essential for long-term health and well-being. The general recommendation for most older adults is to aim for a blood pressure of around 120/80 mmHg. However, recent guidelines from the American College of Cardiology suggest that for those over 65, slightly higher blood pressure readings may be acceptable, particularly if they have no symptoms or major health concerns. The goal is usually to keep blood pressure below 130/80 mmHg, as this range is shown to reduce the risks of heart disease, stroke, and cognitive decline. Scientific studies consistently emphasize that maintaining a healthy blood pressure is one of the most important ways to prevent serious complications as we age. For instance, a study published in the Journal of the American Medical Association demonstrated that seniors with blood pressure consistently over 140/90 mmHg were at a higher risk for developing dementia and cardiovascular issues. As we age, our blood vessels naturally become stiffer and less elastic, which can lead to higher blood pressure. The heart has to work harder to pump blood through these less flexible arteries, resulting in an increase in blood pressure. This process is called arterial stiffness, and it's common in older adults. Additionally, kidney function can decline with age, further contributing to high blood pressure. The kidneys help regulate fluid balance and blood pressure by filtering out excess salt and water. When kidney function declines, the body may retain more fluid, which can increase blood pressure. These physiological changes make it harder for the body to regulate blood pressure naturally, putting older adults at a higher risk for hypertension. Take, for example, Eleanor, a 70-year-old woman who had been feeling more fatigued than usual and experiencing occasional headaches. She thought it was just a part of getting older, but a visit to her doctor revealed that her blood pressure was consistently high, reaching 145/95 mmHg. After making lifestyle changes like cutting back on salt, increasing her physical activity, and managing stress, along with medication prescribed by her doctor, Eleanor was able to lower her blood pressure to 130/85 mmHg. She felt significantly better and was less at risk for developing serious heart-related conditions. This example underscores the importance of monitoring blood pressure regularly and maintaining it in the recommended range. By staying proactive about blood pressure management, older adults can significantly reduce their risk of complications and improve their overall health. Why blood pressure increases with age? As we age, the body undergoes several changes that can lead to an increase in blood pressure, a condition known as hypertension. One of the main contributors to this increase is the natural stiffening of the arteries. Over time, the blood vessels lose their elasticity and become less able to expand and contract as they should. This process, called arterial stiffness, makes it harder for the arteries to accommodate the blood pumped by the heart, resulting in higher blood pressure. In fact, studies show that about 50% of people over the age of 60 have high blood pressure, and this number increases with age. The aging of the arteries is a key factor in this, as it directly impacts how the heart has to work to pump blood throughout the body. Scientific studies have confirmed that arterial stiffness is a normal part of aging. Research published in the American Journal of Hypertension found that the blood pressure of older adults tends to rise more in the systolic, top number, rather than the diastolic, bottom number, due to this stiffening. Systolic blood pressure rises because the arteries can no longer expand to absorb the pressure generated by the heart's pumping action. As the arteries lose their elasticity, they are unable to efficiently handle the pressure, which forces the heart to pump harder, thereby increasing systolic blood pressure. Take the case of John, a 72-year-old man who noticed that his blood pressure had been steadily climbing in recent years. His doctor explained that the stiffening of his arteries was likely causing this rise in his blood pressure. John had been experiencing higher systolic readings, reaching 145/90 mmHg, despite leading a relatively healthy lifestyle. His doctor advised him to manage his blood pressure more aggressively by making lifestyle changes such as reducing salt intake, staying active, and monitoring his blood pressure regularly. Along with some prescribed medication, John was able to lower his blood pressure and keep it in a safer range. This story highlights how arterial stiffness can contribute to rising blood pressure in older adults, and why it's important to be proactive in managing this condition. While arterial stiffness is inevitable with age, adopting a healthy lifestyle, managing stress, and keeping an eye on blood pressure can help mitigate its effects and prevent serious health complications. Regular exercise, a diet rich in fruits and vegetables, and avoiding excessive alcohol or tobacco use can all contribute to healthier arteries and better blood pressure control as we age. The dangers of high blood pressure. High blood pressure is often referred to as the silent killer because it typically has no noticeable symptoms, but over time, it can cause significant damage to vital organs, including the heart, kidneys, and brain. When blood pressure remains high for an extended period, it puts unnecessary strain on the cardiovascular system. This can result in a number of serious health complications, such as heart disease, stroke, kidney failure, and even vision loss. Scientific studies have shown that individuals with untreated or poorly managed high blood pressure are far more likely to suffer from these conditions, especially as they get older. According to the American Heart Association, high blood pressure is a leading cause of stroke and heart failure, and it also contributes to the development of atherosclerosis, hardening of the arteries, which can reduce blood flow to vital organs. One of the most dangerous aspects of high blood pressure is that it can lead to the thickening of the heart muscle, particularly the left ventricle. This condition, known as left ventricular hypertrophy, makes it harder for the heart to pump blood efficiently, increasing the risk of heart failure. In addition, high blood pressure can damage the blood vessels in the brain, leading to an increased risk of stroke. For example, a study published in The Lancet found that high blood pressure was responsible for nearly 50% of all cases of stroke and heart disease. When blood pressure reaches dangerously high levels, it can also lead to aneurysms, which are abnormal bulges in blood vessels that can rupture and cause life-threatening internal bleeding. Consider the case of Susan, a 70-year-old woman who was diagnosed with high blood pressure several years ago. She never experienced any symptoms, so she didn't think much of it at first. However, over time, her untreated hypertension led to severe health issues. She developed heart disease and had a mild stroke, which required months of recovery. After her stroke, Susan became much more vigilant about monitoring her blood pressure and following her doctor's advice to take medications and make lifestyle changes. Thanks to these adjustments, she was able to regain better control of her health and reduce the risk of further complications. Susan's experience emphasizes the importance of regular blood pressure monitoring and early intervention. Without proper management, high blood pressure can silently damage your organs, leading to severe and often irreversible health conditions. By staying proactive, managing stress, eating a balanced diet, and adhering to prescribed treatments, you can significantly lower your risk of the serious complications associated with high blood pressure. How lifestyle affects blood pressure in older adults. Lifestyle choices have a significant impact on blood pressure, especially for older adults. While genetics certainly play a role in determining an individual's susceptibility to high blood pressure, factors such as diet, physical activity, stress levels, and even sleep habits can either elevate or help maintain a healthy blood pressure range. Scientific research has consistently shown that making specific changes to lifestyle can significantly reduce high blood pressure and improve overall heart health. For instance, adopting a balanced diet, particularly one that is low in sodium and rich in potassium, magnesium, and calcium, has been proven to help control blood pressure. The DASH, Dietary Approaches to Stop Hypertension diet, which emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy, has been shown to lower blood pressure by as much as 8 to 14 millimeters of mercury in people with hypertension. Physical activity is another key factor in managing blood pressure. Regular exercise helps to strengthen the heart, allowing it to pump blood more efficiently, which in turn can lower the force on the arteries and reduce blood pressure. A study published in the American Heart Journal found that even moderate exercise, such as walking briskly for 30 minutes most days of the week, can lower systolic blood pressure by 5 to 10 millimeters of mercury. Additionally, exercise helps reduce stress, which is another major contributor to high blood pressure. Stress hormones, like cortisol, can cause the blood vessels to constrict, leading to a temporary increase in blood pressure. Over time, chronic stress can lead to sustained high blood pressure. Take the example of Paul, a 74-year-old man who had been diagnosed with high blood pressure several years ago. Initially, Paul was resistant to making lifestyle changes, but after a conversation with his doctor about the risks of untreated hypertension, he decided to take action. He started walking every morning for 30 minutes and switched to a diet full of leafy greens, lean proteins, and low-fat dairy. He also began practicing meditation to manage his stress levels. Within a few months, Paul's blood pressure dropped from 145/92 mmHg to 128/78 mmHg, and he felt more energized and healthier overall. His doctor praised him for making the necessary changes and emphasized the importance of sticking with them long-term. Paul's story highlights the profound impact that lifestyle changes can have on blood pressure. By focusing on a healthy diet, regular exercise, and stress management, older adults can significantly reduce their risk of hypertension-related complications. While medication may still be necessary for some, combining it with positive lifestyle changes can lead to better health outcomes and a higher quality of life. The role of medication in managing blood pressure for many older adults. Medication plays a crucial role in managing high blood pressure when lifestyle changes alone aren't sufficient. While diet, exercise, and stress management can significantly help, some people still need medication to bring their blood pressure under control. Medications work by either relaxing blood vessels, reducing the volume of blood, or decreasing the heart's workload. The most common types of blood pressure medications include diuretics, beta blockers, ACE inhibitors, calcium channel blockers, and angiotensin II receptor blockers, ARBs. Each type of medication works differently, but all aim to keep blood pressure within a safer range and reduce the risk of complications such as stroke, heart disease, or kidney failure. Scientific studies show that the combination of medication and lifestyle changes is often the most effective way to control blood pressure. According to the American College of Cardiology, treatment with antihypertensive drugs can lower the risk of cardiovascular events by as much as 25% in older adults. However, it's important to work closely with a healthcare provider to find the right medication and dosage, as some blood pressure medications can have side effects, such as dizziness, fatigue, or changes in potassium levels. A doctor will carefully monitor the effects of the medication and make adjustments as needed to ensure the best outcome. Take the case of Linda, a 70-year-old woman who had been struggling with high blood pressure for several years. Despite making significant changes to her diet and exercise routine, her blood pressure remained high, consistently above 140/90 mmHg. After discussing her situation with her doctor, she was prescribed an ACE inhibitor to help lower her blood pressure. Within a few weeks, Linda's blood pressure dropped to 130/85 mmHg, and she started to feel better overall. She was able to engage in her daily activities with more energy, and she no longer experienced the headaches and dizziness she had previously struggled with. Linda's story underscores the importance of not only relying on medication, but also maintaining regular follow-ups with a healthcare provider. The right medication can effectively manage blood pressure, reduce the risk of severe complications, and improve quality of life. However, it's important to take medications as prescribed, avoid skipping doses, and communicate openly with a doctor about any side effects or concerns. By combining medication with healthy lifestyle habits, older adults can better manage their blood pressure and significantly improve their health outcomes. When to see a doctor if your blood pressure consistently measures higher than the recommended range, it's important to seek advice from a healthcare provider. Monitoring your blood pressure at home can be an effective way to keep track of your health, but seeing a doctor regularly is essential, especially if you notice any concerning changes or experience symptoms like dizziness, shortness of breath, or chest pain. A doctor can assess whether your blood pressure is consistently high and recommend the appropriate treatments, which could include medication or further lifestyle adjustments. Regular medical checkups are crucial because high blood pressure often doesn't show obvious symptoms, and leaving it untreated can lead to severe health consequences, including stroke, heart failure, or kidney disease. Scientific studies show that older adults who manage their blood pressure with regular doctor visits and appropriate interventions are less likely to develop complications from hypertension. According to research from the American Heart Association, blood pressure should be checked at least once a year for people over 40. However, for those with high blood pressure or at risk, more frequent checks are recommended to monitor the situation closely and make adjustments to medications or lifestyle as needed. Early detection is critical in preventing further damage to vital organs, and regular medical care can help prevent the development of life-threatening conditions related to uncontrolled hypertension. Consider the example of Barbara, a 75-year-old woman who had high blood pressure for years but didn't realize how dangerous it had become. She was feeling generally okay, without any major symptoms, but her blood pressure readings had been steadily rising. One day, during a routine checkup, her doctor informed her that her blood pressure had reached 160/95 mmHg, much higher than the healthy target. Concerned, Barbara's doctor advised her to start a more rigorous treatment plan, including both medication and lifestyle changes, to avoid the risk of a stroke or heart attack. After several months of following her doctor's plan, Barbara's blood pressure was successfully lowered, and she felt more energetic and healthier overall. Barbara's story emphasizes the importance of seeking medical care if your blood pressure is elevated. Even if you don't feel unwell, high blood pressure can quietly damage your heart, kidneys, and brain over time. Regular checkups with a healthcare provider ensure that you're taking the necessary steps to protect your health. If you notice any symptoms or changes in your blood pressure, it's essential not to delay getting professional advice. Taking proactive steps and maintaining an open dialogue with your doctor is crucial in managing high blood pressure and reducing the risk of long-term complications. As we age, blood pressure management becomes increasingly important. The ideal range for older adults is typically below 130/80 mmHg, and maintaining healthy levels can drastically reduce the risk of heart disease, stroke, and cognitive decline. By making lifestyle changes, taking prescribed medications, and monitoring your blood pressure at home, you can take control of your health and improve your quality of life. So, have you checked your blood pressure lately? If you haven't, it's time to start. Keep an eye on your numbers, make healthy choices, and work with your doctor to keep your blood pressure under control. Let's help each other stay healthy. Share this video with someone who needs to know how important managing blood pressure really is. The more we understand, the better we can protect our hearts and minds. Your heart is your lifeline. Keep it strong by managing your blood pressure.